Good evening. You're very welcome to this, the fifth in the current webinar series for myself and my colleagues here in Teagasc, Sligo, Leitrim, Donegal. My name is Cian Condon. I'm a dry stock advisor based in Manorhamilton, County Leitrim, and I'll be your host here this evening. Tonight, the focus moves on to lameness and onto parasites, and I'm joined this evening by my colleague Tom Coll, based in the Mohill office, and he'll be covering lameness in sheep, and also by Dr. Orla Keane, who has vast experience and knowledge in the whole area of parasites. Obviously, as usual, we're trying to keep things as interactive as possible, and at the bottom of your screen, you'll see a question and answer function, and you can send your questions into our panel right throughout this evening's presentations, and I'll put it to them towards the end. Without any further ado, I'm going to call on Tom to share his screen. Tom, if you're there, and we'll begin.
So good evening, everybody. And I suppose the years, it's hard to believe, like we're only 5 weeks out from Christmas, and probably in the next 5 weeks, depending on the weather condition, it's the time when we'll all be maybe housing our sheep again, for any of us that are going to house them. So what I'll basically take you a rundown through lameness and the lameness issue around housing. So I'll start off by taking you back to maybe 2012. We actually did a lameness study in Sligo, Leitrim here. It was carried out by a young veterinary student, a fourth-year veterinary student, Fergus Hannon, from the School of Veterinary Medicine in UCD. And he actually visited 20 farms in Sligo and Leitrim. It was a once-off visit in July, and he basically examined, looked at the sheep, looked at the ones that were lame, and any sheep that were lame, he turned them over and examined their feet and assessed what was actually causing the lameness. So from his work, it showed that 10% of the sheep that he actually, on those 20 farms, were actually lame. And that ranged from 4% on some farms up to 25% on other farms. So it was back in 2012, and I doubt very much if things have changed. That's generally the run of what's happening out there on farms at the minute as well. So what are the targets? What should we be looking at? Well, we should be trying to get the incidence levels initially, anyway, less than 5%, and I'll talk a bit about that later on in the talk. And the other thing we have to be conscious of at the minute is antimicrobial resistance. So in essence, what we're trying to do is reduce the antibiotic usage that we use for lameness through maybe using prevention rather than treating sheep. So that's what my talk will be based on. So if we look at the yo in the center there, like she's on her knees, on her two front knees. So there's a reason why she's not standing on those 2 feet, and it's generally because lameness is very painful. So it's pain that's putting her down on her knees there. And generally, when you see a sheep like that, that's generally getting most of you aware that there's a kind of cry for help, like so she needs some sort of treatment. And you look around her there, the pictures of hooves around her there, and generally it's one of those pictures there. Some of them look fairly severe, but it's generally one of those reasons there. If you picked up one of those hooves and examined it, chances are it'll be something you'd see there that'll actually be causing it. Like, so I'm going to go through those in a bit more detail. So, so what were the causes of lameness in the Sligo Leitrim study carried out by Fergus Hannon? Well, of the sheep that were actually lame, the cause was foot rot in 41% of them. 32% of those lame sheep were lame because of scald. 9% of them were lame because of Shelley hoof. 5% of them due to overgrown hooves. Toe abscesses accounted for 4%. Toe granuloma accounted for 3%. And CODD, contagious ovine digital dermatitis, accounted for 2%. And then there was other issues as well, such as strawberry foot rot or just injuries and that caused sheep to be lame, or some sort of arthritis or condition within the yos. So generally, they were the actual causes of lameness that Fergus found. So we'll go into each of them in detail now. So scald, and scald, most farmers are very familiar with scald. Like anybody has sheep generally has scald, because the bacteria, it's a fusiform bacterium. It survives in the environment, in the feces, and it's always there. Like, and that's why most farmers come across scald at some stage during the year. It's a very, when you part the hoof there, you see it's pinkish and there's like a creamy slime on it there, and generally that the bacteria gets in there due to skin damage, maybe sheep grazing through rough pastures or thistles or something causing abrasion of the skin, or prolonged exposure to moisture like we have up here in the northwest now, like it just softens the hoof and that's the bacteria in there. So that's generally the first sign of lameness that you'd see, and it's probably the first sign of lameness that you see in your flock, and generally the first sign of lameness you see in young lambs and spring there. And we'll talk about this later on, but the last thing you want is yos going into the shed and then being turned out with the scald bacteria, that they're going to pass it on to young lambs as well. So that's something you're trying to prevent. So in general, and we'll talk about that a bit later on as well, scald is very easily controlled by routine foot bathing. So then the next one, then we move on to is foot rot. So foot rot generally it follows scald. So you've scald first, then it develops into foot rot, and it's different. It's Stachycalibacter then that gets in there and infects that hoof, and generally it eats its way into the hoof there and into the main cleat of the sheep. It's generally foul smelling, so if you smell it, you're going to get a foul smell of it, like a rotten egg. So that the one thing again we'll go into a bit later is it spreads very rapidly in house sheep. It lives on the sheep's feet, and more importantly, in trying to control it, you have to realize that it actually survives off the sheep for about 2 weeks in the environment. So then we'll move on to CODD, which hopefully a lot of you won't have experienced, but if any of you are probably buying in sheep, you may well have experienced it, and it's a nasty one to get into your flock. So it's contagious ovine digital dermatitis. The cause of it is spirochetes. It's in the bacteria that causes it. It's generally associated with bought-in sheep, so something you buy in. If you don't have it in your flock, generally you won't get it unless it comes in bought-in sheep. Even a ram could buy it in, like, bring it in, but it quickly spreads throughout the whole flock if left untreated. And there's instances there where it could spread up to 50 or 60% of the flock, especially if they're inside. So it's something you don't want to get. You can see there I can get I can't get it up there, but it breaks out at the coronary band there, just between the hairline and the top of the hoof, and it'll generally eat away there, and down into the hoof, and the entire hoof comes off. But it also can be foul smelling there, where you actually have foot rot and cod in the one hoof, so that often occurs as well, so it's something just to be very aware of. And like when you're buying in lambs as well, they're not going to thrive when they have this, and can set lambs back, store lambs back tremendously in their thrive. So the next one we move on to then is toe granuloma. So what's the cause of toe granuloma? Unfortunately, it's you that's the cause of toe granuloma by over trimming the hoof. And I used to hear maybe 20 years ago, farmers used to say, you're not doing a good job unless you draw blood. When you draw blood, you're going to probably more than likely end up with a toe granuloma. It's a pea-size little red dot on the hoof, extremely painful. And in general, it requires, it's a colon job. That sheep generally won't heal, and you'll generally have to cull that sheep. So it's something that we've seen in a lot of cases, where lads trim rams, valuable animals, and draw blood, and you end up with these toe granulomas, and they'll never be right for tipping. You'll have to cull them. So foot abscesses, and we move on to foot abscesses. It's the cause is generally something that pierced the foot, or a bit of mechanical damage to the hoof there, and you get pus oozing out from the coronary band, and it's hot to the touch. And in general, if you push it, it'll bust, and maybe putting an Alamycin spray or penicillin or that treatment will generally be adequate for that. Then we move on to Shelley hoof, and it's kind of a crumbling of the hoof. Generally don't know what the cause. There's no real cause identified. Some people put it down to mineral deficiencies of that. Nothing literature to say that that's what it is, like, you know, but can cause lameness, but probably nothing that too serious, like. So then we move on to, you know, when you're housing the sheep and you're introducing lameness causing bacteria into a bedded shed, then basically what you see in front of you there, the writings on the wall, like, it's an animal welfare issue for starters. For any of those sheep that are going to be late, if you take one of those sheep and she's lame, she's generally not going to want to come to the trot, to the silage, or to the meal feeding. She's going to be a shy feeder. She's probably going to get thin. That'll generally results in weak lambs and higher mortality in lambs. Those ewes, lame ewes, are probably more prone to prolapsing. And then when you house them in individual pens, then they're the ones that's probably going to end up lying on their lambs, and you get losses that way. But probably more importantly, she's going to be walking around that entire pen, and she's going to be spreading the infection, and then other sheep are going to pick it up. There's also maybe some links between having the bacteria that cause foot rot on the straw and jointal in lambs and shortly after birth. The more sheep you have lame over the winter, you're constantly treating them. So it's a big labor issue, to go out to grass and getting them back in, treating them. And then ultimately it does cause a reduction in your profitability of your sheep, just by underperforming sheep and not reaching their potential. So why is housing a real risk period? Well, you're basically putting, you know, if you're putting lame sheep into an ideal environment for the spread of it, like, so you've generally warm conditions, damp conditions, poorly ventilated sheds, and a real warm bed for the sheep to be standing on. That's the ideal environment for spread of bacteria. And then you have a high stocking density. The sheep are closer together, so that increases the risk for spread. So you're probably going to generally end up with lameness issues if you combine all of those. So how do we go about controlling lameness at housing? So it's a critical time. So what we need to do is assess all sheep for lameness at housing. So basically, just before they go into the shed, maybe run them through the race, and you know, separate out the lame sheep from the healthy sheep. And both those, whether they're lame or they're not lame, run them through the foot bath. We'll talk about foot bathing later on. Run them through the foot bath, let them stand in it. And then those lame sheep, you know, basically you need to turn them over and see what's actually causing the lameness. And hopefully you hadn't bought any of those, anything like cod or that. Like, it'll either be, probably in most cases, it'll either be scald, which probably, if left untreated, then it'll, as I said, like, it'll develop into foot rot. So you diagnose them, you treat them, and you isolate them. It's important that you don't be mixing those sheep back in with the healthy sheep. And after, we probably should be all working off the basis of 2 strikes and you're out. Like, so those sheep, you know, if they're treated, leave them, maybe treat them and then leave them for about a week or 10 days. And if they're not responding, we'll talk a bit about it later on too. Like, that's the time to cull those sheep out of the system, and that's the only way you really get on top of lameness. And then don't forget about the healthy sheep. Then, like, you know, they should be in different pens, but it's important that you monitor those as well. And any sheep that become lame shortly after housing, they should be removed and put in again foot bath and treated and put back in with that pen of lame sheep. So the foot bath, generally foot baths are made up with 10% either zinc sulfate or copper sulfate solutions. But it's really important that, you know, batch foot baths are ideal, or long races where the sheep can actually stand in the solution. And if you're regularly foot bathing them, you know, 3 or 4 minutes is adequate, especially over the summer and housing. If you want to leave them in longer, all the better. Like, so the longer you leave them standing, the better. But generally, if you're routinely foot bathing them, 3 or 4 minutes is adequate. And the real important thing about foot bathing is when they leave that foot bath, they don't go out into a muddy area to stand in, but they're actually standing on a concrete surface or maybe standing on slats is ideal, like, to allow the solution to actually dry into the hoof, like, you know, and that's as nearly as important as them standing in the solution, like letting it dry into the hoof. So foot bathing, it's important to know that it's there to control scald. That's its main purpose. It'll control scald. It's not that they're really effective against foot rot. If you have established foot rot, for established foot rot, you're going to have to use some sort of oxytetracycline or antibiotics. And then it's basically it has no real use when you're trying to control scald. Like, so foot bathing won't control scald and cod. And if you have an outbreak of cod, generally, you know, it's you have to go to your vet, and it's the stronger antibiotics that you need then to, in consultation with your vet, to actually diagnose it properly and then treat it. Like, so call on the vet when you have cod. The other thing we can use there, and maybe farmers use it, don't have as good a handling facilities and can only run sheep quickly through it, as farmland, because the sheep don't have to stand in it. But you have to remember that farmland gives off fumes, and it's not advisable to be used indoors, and it's carcinogenic, and also for sheep that they've actually painful hooves. And I mean, like, you know, it'll make them even more painful, like when they put the farmland on them. Like, so my advice would be use the 10% zinc sulfate solution or copper sulfate solution, and be very wary of your own health as well. Or if you have kids, you know, about the farmyard, shouldn't be letting your farmland or anywhere near even the sparks of it, like, you know, is dangerous for them. Like, so what are the key issues with house sheep then to you know, controlling foot rot? Is clean. One of them is you know, have a clean, dry bed. Like, you know, it's important. Well ventilated sheds. You can see the sheep there at the back drinking out of the trough there. Like, you know, it's important there's not leakages and them moist, damp conditions. Proper slopes on the floor to keep the bedding as dry as possible. You know, they'll all prevent the spread of bacteria, as will the ventilation of the shed. Like, you know, to get those bugs away. Hydrated lime, antibiotic powders, you know, disinfectant powders, they have a crucial role as well. Like, you know, it can be spread along the feed face there, like, you know, where ewes are generally standing. They help to keep the area dry, like, and help to prevent the spread of it. And antibiotic sprays are important as well. Like, you know, if you don't have foot bathing systems, you know, just, you know, the important thing is to get the sheep out of the pen. But also, you know, you can use those antibiotic sprays as well. They work really well, especially for scald. But early intervention is the key. Like, so don't be leaving a lame sheep run around that pen for 3 or 4 days, because in 3 or 4 days' time, you're probably going to have 3 lame sheep running through it. And the next week, you're going to probably have 10 lame sheep in it. Like, you know, so get them out of there as quick as you can and isolate them. And talk to your local vet as regard if you have major ongoing issues, like, you involve your local vet as well. Like, so just go on to the last slide here. So if we're trying to control lameness in housing, like, facilities are key. Like, you know, as I said, proper housing, good slope floors, slatted accommodations actually ideal, like, you know, because it's dry. And then proper facilities for actually being able to maybe batch foot bath the sheep, or let them stand in a zinc sulfate or copper sulfate solution for 3 to 4 minutes. Have those facilities there, and a dry yard then, or a concrete area or a slatted area for them to stand, so the solution can actually dry into the hooves is vitally important as well. As I mentioned earlier, early intervention and correct diagnosis is vitally important. Like, so you don't want to have a, you know, an outbreak of cod and not have diagnosed it for a couple of weeks, because it'll have spread. As I say, it could spread up to 50% of the flock. And if you're just treating them, run them through a foot bath, it's going to do nothing for it. Or if you're using the wrong antibiotic, it's going to do nothing for it either. So that's where, you know, if you find that there's an issue coming, and you see some of the pictures there that resembles what you have in your hoofs of the sheep, then, you know, you involve your local vet, and he'll prescribe the appropriate antibiotic for that. And we have to be wary again of AMR and the use of antibiotics, and you don't want that to spread through the flock, such as things like cod, because then you're using a hell of a lot of antibiotics, there's an issue then when you're overusing them. There's, they're going to be an issue then with human health and their efficacy in the human population then. So that's where vaccination maybe comes in. But vaccination alone, won't control even foot rot or lameness in the flock. Like it's a combination with having the right facilities and doing the other things that I was talking about. And alone, the studies in the UK there were showed that vaccination alone probably was only maybe 60-65% effective against controlling lameness in the flock. But you need all the other things combined with it. But where you have a serious outbreak of lameness, maybe vaccination will get it under control. Then you put in the facilities and get it fully under control then. So biosecurity is vitally important there, that you, again, with diseases like cod and even foot rot, that you don't be buying them in. So you isolate, run your sheep through the footbath, isolate them for 28 days, keep them away from other sheep. So they're not spreading it to the flock. And generally, if something's going to develop, it'll generally develop in those first 4 weeks after purchasing. Avoid trimming hooves. I suppose that's a big one. And part of that study that was done in 2012, the farmers that carried out the study, I know there's a good few of them that haven't trimmed a yo's hoof since 2012, even the long hooves. Research in the UK would show that those hooves, will generally wear down anyway, and generally the flocks in the UK that were actually trimming hooves had higher incidence of lameness. That's generally because that bacteria is getting onto the shears that you're using to trim the hooves, and then you're clipping another hoof and spreading it to that, and you're clipping another yo and then spreading it on. So if you do want to go and trim anything, make sure you disinfect the hooves between sheep and between hooves. And I suppose the one that we're not really good at is Coll repeat offenders, because they're always going to keep the bacteria there in the flock and prolong the spread of it. I know of one scanner that scanned out in New Zealand, and he was sitting in the scanning trailer and wondering why a lot of the sheep were being drafted off before they actually got to the scanner, and that was because of lameness. They didn't even bother scanning the sheep, so we probably have to be more ruthless and get rid of the repeat offenders, if we're going to control lameness. So just go back to the incidence of lameness. When you get it under control and you get it down to less than 5%, then you start thinking about getting it down to less than 2%. And a good few farmers have done that just by having the facilities, regular foot bathing, not buying in problems, and controlling scald will go a hell of a long way to controlling foot rot in your sheep, and that'll go a long way to reducing antibiotic usage through preventative measures. So thanks very much for listening, and I'll take any questions after there.
That's great. Thanks, Tom. I'll just remind you that the question and answer function is available there at the bottom of your screen. So if you have any questions with regard to lameness or Orla's presentation coming up here now shortly on parasites, please feel free to send them in and we'll get answers for you before the evening is finished. Orla, are you ready to go?
Yeah, is that looking okay there, Keane?
That looks good. Thank you very much.
Great. Thanks. Okay, so I'm just going to speak now for the next maybe 15 or 20 minutes or so on parasite control in sheep. So I'll just kind of briefly mention the major internal parasites of sheep. That's what we're going to focus on today. And then, given the time of year that it is, spend a bit of time talking about liver fluke. So going through the liver fluke life cycle, because that's really important to understanding how we aim to prevent, diagnose and control liver fluke. Now, elements of control rely on the use of Flucocides. So I'll just kind of remind people of what classes of Flucocides are out there and when is the best time to use the different classes. And then I'm just going to briefly mention at the end gastrointestinal nematode control. And I'm going to mention that for a couple of reasons. So the first one is that for the last year, we've been promoting in Teagasc 4 key actions to slow the development of anthelminthic resistance on sheep farms. So, we identified kind of 4 very simple steps that people can take that should have an impact on the ground in terms of slowing the development of resistance. So I just want to remind people of those. And then finally, as people probably know, there's changes to the route of supply of anthelminthics come into effect in January next year. So in advance of that, we're doing a parasite control survey, just looking at practices now with the aim of looking again in a couple of years' time after the route of supply has changed. So I'll be encouraging people to take part in that survey if they can. Okay, so in terms of the major internal parasites of sheep, well, the major internal parasite of concern, it really depends on the time of year. So with young lambs, it's Coccidia and Nematodiris. Throughout the summer and the autumn, it's generally the stomach worms. But at this time of year, the major parasite of concern is quite often fluke, particularly in an area like Sligo, Leitrim, Donegal. And, you know, recent work has estimated that internal parasites cost the Irish sheep industry about 10 million euro per annum. And the majority of that is attributed due to primarily lost production due to stomach worms. So that's 8.8 million. And the balance is primarily attributed to liver fluke, a cost of about 1.2 million. Now that's an average over the whole country. Obviously in an area, again, like, you know, Sligo, Leitrim, Donegal, that's an area that's particularly at risk of fluke. So the balance might be slightly different in that area. And I suppose what I've got down here is just if anyone is interested to see what these little parasites look like. So this is a worm. This is the type of worms that are out on the pasture that the sheep pick up when they graze. It's barely visible to the naked eye. It's smaller or thinner than an eyelash. And then this is just a fluke that was recovered from the liver of an animal at slaughter. So as I mentioned now, this time of year, liver fluke is generally the main concern. And this here just shows a diagram of the liver fluke life cycle, because liver fluke has very much a seasonal life cycle. And that's really important in terms of when, you know, when animals are at risk. So ewes in the springtime, if they're infected with adult liver fluke, those adult liver fluke will lay eggs and the eggs will be passed out in the dung. Then if the weather conditions are right, and that involves generally mild conditions, so temperatures above 10 degrees, those eggs will embryonate and hatch into Miracidia. So again, this cycle tends to start in maybe April or May, when you get that kind of mean temperature reaching over 10 degrees. Now, once the eggs hatch into Miracidia, these Miracidia have only a matter of hours in which to find and infect a mud snail. And when they do, they spend about 6 weeks or so replicating within the mud snail, and then the mud snail, it can release a lot of cercaria onto the grass. So, you know, if the cycle starts in kind of April, May, it takes about a month for these to hatch. They maybe infect the snails in June or so. They're about 6 weeks in the snail. So it's into kind of late July, August is when these cercaria generally will start to appear on the grass. And then the cercaria insist on the grass, where they're ingested by grazing animals. And then once the metacercaria are ingested, they go through the wall of the intestine and they burrow their way through into the liver of the animal. And then they spend between 8 and 12 weeks as immature fluke, munching their way through the liver until they find their way into a bile duct, and then they mature in the bile ducts and into adults where they lay eggs. So because of this, we tend to see, as I said, a very seasonal pattern of exposure. So what happens is there'll be some of these metacercaria out in the grass. They will survive the winter, but they'll start to die off in the spring. But of course, if ewes are infected, they'll be shedding eggs out. And once the temperature reaches that critical threshold, those eggs will embryonate and hatch, and then snails will be infected. The snails will spend a number of weeks infected before they release cercaria onto the grass. So what you find is in late summer and into autumn is when you start to see these cercaria being shed. And so from autumn and into winter is the very high risk grazing period. So that's the period around now, tends to be the high risk. Now, the Department of Agriculture, in collaboration with Met Éireann, they can predict based on the weather pattern throughout the year how high the risk is in different areas of the country, and they use weather data from the Met Éireann weather stations to do that. Now, they use the weather data generally from May to October. So they collate the data in early November, and generally in around mid-November, the Fluke forecast appears. So we'd expect the 2021 forecast should be out in the next week or so. So keep an eye out for it. But in general, the Northwest is considered a high risk area because wet areas tend to be high risk areas. And given the weather that's been out, that's, has happened this year, again, the Northwest tends to be high risk. There's also some information coming out of the Animal Health Ireland Beef Health Check programme. So this is this basically records the data from the liver inspections at abattoirs throughout the country, and they can report liver damage due to fluke or the presence of live fluke. And now, while it is in cattle, it's the same fluke that infects sheep and cattle. So if an area has got a high prevalence of fluke in cattle, you'd expect to have a high prevalence of fluke in sheep. And they find that over 70% of cattle herds in Sligo, Leitrim and Donegal have signs of liver fluke at slaughter. So basically, that's just a very, very long-winded way of saying that Sligo, Leitrim, Donegal is a very, very high-risk area. In sheep, the Department of Agriculture also collect blood samples from lambs from going through the factory. So they collect them from all over the country, and they test those blood samples for antibodies to fluke. And again, they will produce these maps that tell you where the lambs have tested positive for fluke. This is the latest one they've produced from October 2021. And what you'll see is, again, most of the red spots, so this is where they've tested positive for fluke, are in the Northwest and the West. Okay, so what can we do to prevent fluke? I mean, in theory, I suppose you can drain localized wet areas to reduce the snail habitat. That obviously reduces the habitat for everything, not just the snail. So, there might be biodiversity reasons that people don't want to go down that road. Or you can kind of restrict access to snail habitat. So particularly wet areas, maybe avoid grazing them in the autumn, in the late autumn. And I know we would certainly have, we'd work with some farmers who do that. They'd know they'd have areas very, very high risk, and they don't graze them past October. Sometimes people house animals to avoid the risk of fluke, but the main, one of the main ways is treatment with Flucocides, and that can also prevent disease. So if you prevent ewes shedding the eggs in the spring, then you're preventing the lambs or other animals on the farm picking up the fluke later in the year. So treatment with Flucocides to prevent eggs being shed in the spring will have a knock-on effect the following autumn. So control in the spring, it's really about preventing snails becoming infected. So that's making sure that ewes are not shedding fluke eggs onto the pasture. And that's done generally by treating them with a Flucocide that targets the adult fluke. In summer, the dry weather should hopefully reduce the snail population. In autumn, you may want to prevent animals from grazing very high risk, very wet areas. And animals may also need treatment. But in this case, because they'll have picked up the infection quite recently, you'll be treating for immature fluke. So the aim there is to prevent the immature fluke from migrating through the liver and damaging the liver and developing into adults and laying eggs. Winter, again, treatment of at-risk animals, but in this point they might be infected with adult fluke that are laying eggs. So you'll be aiming to use a product that kills adult fluke and maybe immature fluke as well to prevent liver damage and chronic infection. So, of all the different Flucocides on the market, they fall into these different classes. Now, I've grouped the clasantal and rofocinide together because these two are often treated as different classes, but they're chemically similar. And it is reported that if you're resistant to one, then you've also probably resistance to the other. So in terms of the classes that we have, triclobendazole is a class that would have been very, very widely used in the past. And the reason it's been very widely used is that it will kill both the early immature, the immature, and the adult fluke. So it takes the fluke about 10 to 12 weeks to reach adulthood. So these triclobendazole will kill fluke from about 1 or 2 weeks of age. For closantel, rifoxamide, and nitroxanil, they will kill the fluke from about 6 weeks of age. So they'll kill immature fluke and adult fluke, but they won't kill the early immature fluke. And the other two classes, oxyclosanide and albendazole, they only kill the adult fluke. They don't kill the early immature or the immature. So that means the fluke have to be, at least probably 10 weeks of age before they'll be targeted by these drugs. So for this reason, we triclobendazole tends to be used in the autumn, just when they pick up those fluke and the fluke infection is quite new. Closantel, rifoxamide, nitroxanil also used in the autumn and into winter to target the immature fluke. And quite often the oxyclosanide and albendazole, that's a treatment that might be given later or winter or in the spring when the fluke have matured through to adults and to stop those adult fluke laying eggs that will be passed out with the dung. Now, just one thing to mention is that apparently nitroxanil, they're ceasing, so that's Trodax, would be a product with nitroxanil, that they're ceasing production early next year. So that product might become unavailable in the near future. So in terms of diagnosing fluke, well, an awful lot of the diagnosis is basically on farm history. People will generally know if there's been a history of fluke on the farm. And post-mortem examination of livers at the abattoir is really useful. Now, it can be very difficult to get the data from that for sheep, but anyone that has cattle as well as sheep, it may be possible to get that through something like the Beef Health Check Scheme. So this is where they record the liver inspections and they will tell you, they'll give you a score whether there's a normal liver damaged but no sign of live fluke, whether live fluke were seen. And as I said, it's the same fluke that's infecting the cattle and sheep. So if your cattle are infected, if the sheep are grazing the same pasture, then they're at risk as well. Fecal egg counts, again, anyone who has cattle and was involved in the BPS scheme may have actually carried out fecal egg counts this year. And they can be useful, but I suppose the only thing to bear in mind about fecal egg counts is you're only picking up the adults. So it takes about 10 to 12 weeks for the fluke to develop through into adults and to start laying eggs. So your fecal egg counts won't pick up early immature or immature infections. There are also coproantigen tests. I mean, we're hearing an awful lot at the moment about antigen testing with COVID, but you can also do antigen testing for fluke. And in this case, it uses a fecal sample. So it's a testing for fluke antigens in a fecal sample. And the likes of the coproantigen test or the serum antibody tests, they can be done in veterinary laboratories, but they have their drawbacks as well. But I suppose the main thing to say is this time of year, if there are any sudden deaths, get them, investigate them, send them in for post-mortem if possible. That can be a sign of acute fluke. In terms of flucocide resistance, we know certainly for the gastrointestinal nematodes that amplomythic resistance is now kind of at a critical level and seems to be increasing all the time. In terms of fluke, resistance to triclobendazole in fluke was first reported in 2009, and it's now believed to be reasonably widespread, and that probably reflects the widespread use of triclobendazole because it was such a great drug that killed all the way down to the early immature stages. Now, the other classes are presumed to be effective in Ireland, but to be honest, we're not doing an awful lot of testing for resistance in fluke. It's not a particularly easy test to do, and there's not an awful lot of testing going on. But for now, we're assuming that the other classes of flucocides are effective. But as I mentioned before, Trodax is going to disappear from the market next year. And that leaves, if you think about it, then if you go back to, if you're in a situation where you have triclobendazole resistance on the farm and nitroxanil comes off the market, that really only leaves one class of flucocide to control the immature fluke. So that is a bit of a concern. Okay, so I just briefly want to mention the stomach worms as well. The main reason for that is that we've been promoting all year these kind of 4 key steps to slow the development of resistance to wormers on sheep farms. They're fairly easy, they're all fairly straightforward steps. The first one is not to treat mature ewes for stomach worms unless there is a demonstrated need. So unlike Fluke, where mature ewes are at risk of Fluke and do need treatment, mature ewes are generally not at risk of stomach worms. They've built up their immunity, and it's rare that stomach worms are a problem in mature ewes unless there's some other underlying health or nutrition issue that's making them more susceptible. So they shouldn't need routine treatment. I mean, there may be the odd ewe here and there that needs treatment, but generally treatment should be on the basis of a need for treatment rather than blanket treating mature ewes for stomach worms. And that applies then to using combination wormer flucocides. You know, there's no need, if you're targeting fluke in ewes, there's no need for a combination wormer flucocide. It could do more harm than good. If you're targeting fluke, then just use a flucocide. In the spring, we recommend only using a white drench to treat nematodirus in lambs. And this is because we know there's widespread resistance to the white drenches in all the other stomach worms, but not in nematodirus. So it makes sense to use that drug for nematodirus and to hold the others in reserve for later in the summer against the other stomach worms. This third one now, I kind of can't stress this highly enough. Resistance is now really widespread. So Tom was talking there earlier about buying in problems in terms of lameness. You can also buy in problems in terms of worms that are resistant to anthelminthics, to wormers. It's so widespread now that if you buy in large numbers of sheep, this is a very, very serious risk. So you need to have a good quarantine drench to prevent bringing in this problem onto the farm. And that means using one of the new prescription only wormers. So a number of years ago, 2 new wormers came out on the market, Solvix and Startect, and they're veterinary prescription only. Now, Startect isn't currently available. So that means in terms of this quarantine drench, you know, it really has to involve the use of Solvix, which involves getting a prescription from your vet, but it is worth it in the long run. I'll have a slide now in a minute as to some of the farms that we're working with that have problems with resistance and you know, what it is meant for them. So this is definitely, it's definitely worth doing. And then find out what products. I mean, one of the most important things you can do to slow the development of resistance is to only use products that work. Using products that don't work make the problem worse. So you want to do a test, a post-dosing test, to make sure that your wormer worked. So have a chat with your vet or your advisor about doing a drench test. So this is really, you know, taking a sample pre and post dosing and making sure that the wormer killed off the worms, or, you know, dosing based on fecal egg count. So using that to guide when lambs needed to be treated. So these 4 actions were picked because they basically try and mitigate some of the risk factors that lead to the development of anthelminthic resistance. So there's 4 kind of known risk factors: how bad the resistance problem is now, so what the problem is like right now, how often you treat, if you undertreat, and refugia. So refugia is the proportion of the worm population not exposed to the anthelminthic. So if you think of all of the worms on the farm, some will be in the ewes, some will be in the lambs, some will be on the grass, and the more that aren't treated with a wormer, the better. So again, this comes back to leaving the ewes. That's a major reason for leaving the ewes untreated. But just to say that resistance it's very much a slippery slope. So when it starts to develop, it develops very, very slowly at first, but there will be a tipping point at which point it gets worse. So when it develops slowly, unless people are testing, they might not realize they have a problem. And they might be somewhere down here before they realize they have a problem. And at that point, it's very late to start putting in steps to mitigate this. So this comes back to, you know, the drench testing. You want to be testing and you want to be putting in the steps up here before resistance develops. because we are increasingly seeing more and more farms with resistance, and particularly with multi-drug resistance. And so what's happening is that we're being contacted by farmers who are starting to see, you know, major failures on the farm. They can't control the worms on the farm, and they get in touch with us. And we now have some flocks that have resistance to all 3 classes of commonly available wormers: the white wormers, the yellow wormers, and the clear wormers. And what that has meant for them is that for some of these farms, they've had a 30 to 40% reduction in their growth rates post-weaning. So where they were doing just over 200 grams a day post-weaning before they had a problem, they're now down at maybe 140, 130 grams a day. They can't finish lambs. So again, we've got flocks where by the end of September previously, they would have had 85, 90% of lambs drafted. They're now down at maybe 45% of lambs drafted. They can't get them finished. And we've had flocks that have had to house lambs early to finish them. They've housed them, they've put them on meal to finish them and get them off the farm because they have a resistance problem. So, you know, what I'm saying is, if you're not there, you don't want to be there. So these are 4 simple steps. Don't dose mature ewes unless there's a demonstrated need. Next spring, use a white wormer for nematodirus. Talk to your vet, get Zolvix. If you are buying in, make sure you have a good quarantine drench in place, and find out what works, and only use wormers that work on your farm. Okay, there's also a lot of information on the Teagasc website. So if you go to the Teagasc website, there's a whole section on anthelminthic resistance. There's a leaflet on those 4 key steps. There's a video explaining anthelminthic resistance, and there's a video on each of the four steps and kind of explaining how or why they work. And there's also some really good information on the Animal Health Ireland website as well. They have some parasite control information leaflets for sheep. Okay, then the last thing I just briefly want to mention is the new regulations. So there are new veterinary medicine regulations coming into force in January next year. And so it is proposed that all anti-parasitic medicines, so all wormers and flucocides, will require a prescription from your vet. I understand that the prescriptions will be electronic, and they'll be valid for up to 1 year. And all of the products will still be available for sale in the same sources as before. So you can get your wormers in the same places as you did before, but it will need to be on foot of a veterinary prescription. So that just brings me then to, I think I mentioned at the start there, we're doing a survey at the moment. So we have a survey for dairy, beef and sheep farmers. This is the link. Your advisor will also hopefully be sending out the link as well. So what we're trying to do now is to get a handle on parasite control practices now. So basically using the end of the year to kind of look back at the previous grazing season and see what did people do this year, which is the last year before the new regulations come into place. And then we'll probably look again in a few years' time when the new regulations have had a chance to bed in, and see what, if any, changes there have been. So anyone, I would encourage anyone who can to go online and fill out the survey, or otherwise their advisor should have a paper version. If you'd rather fill out a paper version, that's fine too. So I think that's all I have.
Okay, thanks very much, Orla. That's great. There are plenty of questions after coming in here. So I'll put the 3 of us back on screen and we can start on some of these questions. I'll go to Tom first. Tom, are you there yet? Tom,
Yeah.
What is the best and most appropriate treatment for CODD?
The best treatment for CODD is what it says, talk to your vet. Like, you know, I'm no vet, like, not qualified. If you've identified a problem with CODD, like, you need to talk to your vet, and I'm not going to give you the solution to it. Like, it's your vet that's qualified to give you the solution for it. Like, but they're generally the high end drugs, like, you know, and some of them can only be administered by the vet as well, like, you know. So
Yeah, that's great. Thanks, Tom. One of the most recent questions in here, Orla, is for lambs that are to be retained as replacements, at what age do you think they've developed sufficient immunity that you
Yeah,
could think about cutting out worming?
that's a really good question. So it generally will take them up to 2 years to develop good immunity. So certainly if you're if you're mating young lambs, and if you're going to have lactating yearlings, then they would certainly be under pressure, and they may require treatment with a wormer. So, it is really around mature ewes that they should have good immunity. With ewe lambs or yearlings, it's less clear, and certainly if they're under pressure, they probably will require treatment.
Okay, thanks, Orla. Tom, there's a good few questions that have come up in here about the use of zinc sulfate, copper sulfate, and the 10% solution, and questioning if it's a problem. Should it be made up to a higher concentration, and should you be checking the concentration in it, after you've used it 1 or 2 or 3 times? You just want to comment on making up the solution, to what level, and whether or not it needs to be maintained after that.
Yeah, so we'll take a 10% solution. So it's 1 kilo of product to 10 liters of water, or 10 kilos of product to 100 liters of water. So you need to know the surface area of your footbath, and calculate it up that way, or how much water you're actually putting into the footbath. The good thing about zinc sulfate is that it survives for you get a number of foot bathings out of it, and feces, and that generally doesn't really cause a problem. So in cases there you could use it for 6 weeks, but it's where the footbath kind of turns into slurry then, or you have it out over the summer, and you get a lot of evaporation and the water's gone out of it, or if you the opposite as well, if you get a lot of rain that dilutes it. So the ideal thing is to have a roof on it, and have it indoors. It'll last a bit longer. To see if it's a 10% solution, you can measure the specific gravity by getting a hydrometer. You can buy get a hydrometer online. What I advise you to do is if you buy the hydrometer online, get a kilo of zinc sulfate and 10 liters of water, mix it in a bucket, and drop your hydrometer into it, and put a mark on the hydrometer where it floats the surface where the water where it meets, and then you can use it from then on. You'll have calibrated your hydrometer. So generally, I see there was another question there about how often should you footbath sheep. So you're footbathing them to control scald, and it depends how big a problem scald is. When you put sheep into in for the winter there, you generally want to kind of control that scald. So maybe run them through 2 or 3 times initially. Generally, if the scald isn't, it should be fairly well controlled after that. And probably the last thing you want to be doing is heavily pregnant ewes running through a footbath. So generally you'd ease off in it. But during the summer period there, where you've ewes and lambs together, and you should, it's a good way of thinning the lambs as well, letting them run through the footbath with the ewes. Basically every time you have them in, it should be running through a footbath. And those periods over the summer, if you're dosing, you're vaccinating, you're drafting, basically every time you should have a facility set up that, while have a batch footbath or some area in your race that they can stand in while you're working on other sheep for that. So get into the routine of when you're routinely foot bathing sheep. Any farmers that are routinely foot bathing sheep generally don't have an incidence of lameness in their lambs, because they're controlling the scald. And the same with their ewes. You control the scald, you're controlling the lameness.
Great, thanks, Tom. Another question came in here about the similarity between closanthal rifoxanide, and this person has asked about Fluke and the fact that they used to use Ridafluke. Now, but just maybe Orla or Tom, if you like, but I'm just thinking, do you want to comment on whatever about the individual doses here, but about I often get asked questions about using a particular dose. Do you use it for a year? Do you alternate doses from different families? Can you comment on that, please? Oh, you're just on mute there.
Sorry, I'm on mute. Yeah, that's something that has certainly kind of been advocated in the past, and it's no harm, but it's not as important as people think. What's more important is to use something that works. So, you know, it's more important to use one that's effective than to rotate. But if everything works, then fine, yes, rotate and use different products. Obviously, with the Flucocides, they have different spectrums of activity. So only triclobendazole does down to the early immatures. For your immatures, you have the rifoxamide, closantel, nitroxanil. So you've those three. Obviously, that's going to become harder now to rotate them if one goes off the market. And the other two are not, they're not completely different drugs. They're not completely different classes. They are related in some way. So it does limit your scope for alternating. But what's more important than alternating is to use something that works.
And just the end of that question, it's nearly like a second part, is the person has said that they don't want to use a product with confirmed resistance.
So yeah, so I suppose you absolutely don't want to use a product with confirmed resistance. But the question is, does that person have resistance on their farm? Or so we know there is resistance out there, but it will vary from farm to farm, and every farm can have its own profile. And that's something we very much see with the stomach worms, whereby some farms will have very little resistance, some farms have multi-drug resistance. So yeah, it comes down to what works on your farm, and the only way to know that is to test.
Yep, that's perfect. Thanks, Orla. Just a general question here. Now, the question is about maybe putting sheep on half rations or something like that before dosing. Do either of you want to comment on any? Is there any specific management that you need to do, Tom or Orla, before actually dosing animals for worms or fluke?
So I suppose, yeah, Tom can come in there. So, you know, if animals are fasted before they're dosed, it'll slow down the passage of the digesta through the tract and increases the absorption time. And so that has been recommended for white wormers, but it's not recommended for yellow wormers. So, you know, you have to be kind of careful about what class of wormer you're using if you're going to do that.
And the other thing, Orla, I think is it's fairly prolonged period of fasting as well. Like, you know, so is that practical?
24 hours, yeah, exactly. So it's not that practical.
No.
Yeah.
Farmers aren't going to do that. Like you're busy enough, and your labor is part-time farmers are probably dosing their sheep at the weekend, like, and get them in and out as quick as they can, get the job done, like, you know, apart from the time that they're going to be standing in the footbath. That's the best time used.
Another question here asking, if a flock has built up resistance to, the example here is triclobendazole, is it possible after a number of years that you can reintroduce your, let's say, old dosing regime?
Yeah, that's a great question. Something that we're actually, you know, doing a little bit of work on at the moment. But I guess as far as we know now, the answer is it doesn't go away. Once you have resistance, it doesn't go back. And there have certainly been studies with white wormers, the likes of your albendazole and these products, that have shown once you have resistance, they've had farms that haven't used it for 20 years, gone back 20 years later, and the resistance is still there. So I certainly wouldn't bank on it disappearing if you don't use the product. There have been a couple of reports from other countries where they say maybe it gets better if you don't use the product for a long period of time, but it's not something I would be banking on.
Okay, and I'm just gonna, I can see the time now, we're running over the hour, but just one last question come in here. There's a specific question, but I'm going to ask it in a general way about, it says about spreading lameness. Now it mentions certain activities, but I'm just wondering about the spreading, let's say, of whether you want to use parasites or whether lameness by the use of shared facilities. Do you want to just either of you comment on that?
So I suppose, like, if you're even sharing a trailer, like with a neighbor, like that there is a chance that the bacteria would get into this. If there's a lot of dung and mud, and the bacteria can maybe spread into that. Like, so it's good practice no matter what to prevent any disease, like, to clean out the equipment and disinfect it, like, properly, like, that's the recommendation. And I wouldn't be shy of if you even shearers come in, make sure that the equipment's clean, and take your time and clean it down and disinfect it before they use it, like, and don't be shy to do that, like, because the consequences of taking in some other disease, like, could be painful for you and for the sheep.
That's great. Thanks, Tom. We're over the hour, so I think we'll wrap things up. That's it for this evening. We hope you found the presentations both useful and interesting. And as usual, is that all of these presentations will be made available on our YouTube channel in the coming weeks. Next week's webinar will cover water quality issues in priority action areas, and there will be a focus on the disposal of sheep dip. So we'd love if you could join us again. That's it for this evening. Thanks to everybody for joining us. Thanks to Orla for her time, and thanks to Tom as well for your very good presentations. Very useful, loads and loads of questions this evening. Thanks a million to everybody for joining us. That's it for tonight. Stay safe and good night.